happy one minute, yet extremely sad or depressed the next. Some may think this person is just unstable, but they may have a much more serious condition, bipolar disorder. Bipolar disorder is a complex physiological and psychological disorder that can influence and manipulate a person's thoughts and actions in their daily life. There are many different types of bipolar disorder, including bipolar 1 disorder, bipolar 2 disorder, cyclothemic disorder, rapid cycling bipolar disorder, and bipolar disorder not otherwise specified. According to the Mayo Clinic website, bipolar 1 disorder is defined by manic or mixed episodes that last for at least 7 days. During this, a person may experience manic symptoms that are so severe a person needs immediate hospital care. Bipolar 2 disorder is defined by a pattern of depressive episodes and hypomanic episodes, but no full-blown manic or mixed episodes. Cyclothemic disorder, or cyclothemia, is a mild form of bipolar disorder. People with this usually have episodes of hypomania as well as depression that last at least 2 years. Bipolar disorder not otherwise specified is diagnosed when symptoms of the illness exist but do not meet diagnostic criteria for either bipolar 1 or 2. The most severe form of this disorder is rapid cycling bipolar disorder. This occurs when a person has 4 or more episodes of major depression, mania, hypomania, or mixed states all within a year. Rapid cycling is more common in those who started having bipolar episodes at a young age. Everyone has been sad or depressed at times, with feelings of uselessness. Some people have mood swings that occur a few times each year, while others experience mood swings as often as several times a day. Although bipolar disorder is a long-term condition, there are still ways to keep one's moods in line. Currently, the exact cause of bipolar disorder is unknown, although many factors may be involved in the causes of bipolar episodes. Bipolar disorder tends to be genetic. People with certain genes are more likely to develop bipolar disorder than others. Children whose parents are bipolar are more likely to be diagnosed with bipolar disorder. Some other factors that may increase the risk of getting bipolar disorder may be having an imbalance of hormones, periods of high stress, drug or alcohol abuse, and major life changes such as the death of a loved one. There are signs and symptoms of both types of bipolar disorder, mania, and depression. According to the National Institute of Mental Health, some signs of the manic phase of bipolar disorder may include inflated self-esteem, poor judgment, rapid speech, racing thoughts, aggressive and risky behavior, and a decreased need for sleep. Signs and symptoms of the depressive stage of bipolar include sadness, hopelessness, suicidal thoughts and behavior, anxiety, sleep problems, and guilt. Although bipolar disorder cannot be cured, it can be treated for a lifetime. With the right treatments, even the most severe forms of the disorder may be treated. However, even with the proper treatment, mood changes may still occur. Treatments may include a combination of medication, therapy, or other treatments. Hospitalization may be necessary to treat patients who feel suicidal or detached from reality. Substance abuse treatments may also be necessary if the patient has trouble with drugs or alcohol. Psychiatrists recommend medications at first to help patients with bipolar disorder to balance their moods and control symptoms as fast as possible. Once the symptoms are controlled, maintenance treatment is needed to manage bipolar disorder. Without maintenance treatment, the chances of relapse is higher, and there is a greater chance that minor mood swings could turn into full-blown mania or depression. There are many drugs that are used to help treat bipolar disorder. Different medications are used depending on the type of bipolar disorder and the person's individual symptoms, medical history, and overall health. Also, according to the Mayo Clinic website, some prescribed medications for bipolar disorder include lithium, anticonvulsants, antipsychotics, and antidepressants. Some medications may take weeks to months until they make full effect. The next step after medication is psychotherapy. This may provide guidance for people with bipolar disorder. Cognitive behavioral therapy may help people learn to change their harmful or negative thoughts and behaviors. Family-focused therapy involves family members and helps them understand the illness more and see the early signs when a manic episode is occurring. Interpersonal and social rhythm therapy helps people improve their relationship with others, and regulate things in their daily routine. Psychoeducation teaches people with bipolar disorder about the illness and its treatments. This may help a patient recognize mood swings and learn to stop one before it happens. Electroconvulsive therapy, ECT, is used in cases in which medication and psychotherapy do not work. If bipolar disorder is left untreated, there can be major complications that may affect one's lives. Bipolar disorder is a serious condition that can cause rapid mood shifts and can lead to many other complications. Today, we have explored the types, symptoms, and treatments of bipolar disorder. Rather than thinking someone is simply unstable when they have rapid mood shifts, you will now be able to recognize a potentially serious condition, bipolar disorder.